Did you know your kidneys can lose up to 60% of their function before a standard checkup ever catches it? That is not a typo. Your kidneys are so good at compensating for damage that they will quietly cover for each other until more than half their capacity is already gone, and by the time most people get a diagnosis, they assume it happened fast. It did not. It took years. And the whole time, your body was sending you small signals that almost nobody is taught to recognize. So in this video, I am going to walk you through 8 warning signs your kidneys send out long before a doctor ever orders the right test. Some of these you have probably felt and brushed off as nothing. A couple of them might surprise you completely because they do not look like a kidney problem at all. By the end, you will know exactly what to watch for, and more importantly, exactly what tests to ask for if any of these sound familiar. Before I get into the first one, do me a favor. If this is useful to you, hit subscribe and leave a comment telling me which one of these 8 you have actually noticed in yourself. I read every comment, and honestly, they tell me what to cover next. So let's get into it. Here is what almost nobody explains to you in a rushed appointment. Your kidneys are 2 fist-sized organs sitting just under your rib cage in your lower back, and their main job is filtration. Every single day, they filter about 50 gallons of blood, pulling out waste, balancing your fluids, regulating your blood pressure, and keeping your electrolytes in a tight, narrow range your whole body depends on. When that filtration system starts to slip, the waste your kidneys are supposed to remove starts to build up in your blood instead. And that buildup does not stay contained to one organ. It touches your skin, your energy, your sleep, your blood pressure, even your breath. That is exactly why kidney damage shows up in so many disguises. It rarely announces itself as a kidney symptom. It shows up everywhere else first. I want to be straight with you about something before we go further. None of these 8 signs are a diagnosis on their own. You cannot look at a symptom and know your kidney function. The only way to actually know is a simple blood test called eGFR, estimated glomerular filtration rate, paired with a urine test that checks for a protein called albumin. Those 2 tests together are what your doctor uses to see what a symptom alone cannot tell you. So think of this video less as a self-diagnosis tool and more as your early warning radar, the thing that tells you it is time to ask for that specific test instead of waiting for your next physical to catch it by accident, if it catches it at all. There is no real financial incentive in the system to chase a problem early when it is cheap and quiet. There is plenty of activity once it becomes expensive and loud. That is not a conspiracy. That is just how a reactive system tends to behave. So I would rather make sure you know how to catch it early yourself. I am Dr. William, and every one of these 8 signs falls into one of 3 categories. It is a sign your kidneys are struggling to filter waste properly, a sign your fluid and electrolyte balance is drifting, or a sign the hormones your kidneys help control are getting thrown off. Let's start with the first one. The first sign is unusual fatigue that does not match your sleep. Not the normal tired you feel after a long day. I mean a heavy, bone-deep exhaustion that shows up even after 8 hours of sleep, the kind where you wake up and still feel like you need another night of rest before you have even gotten out of bed. If you have been writing this off as stress or aging, I want you to pay closer attention, because this is one of the earliest and most commonly dismissed signs on this entire list. Here is what is actually happening inside you. Healthy kidneys produce a hormone called erythropoietin, and that hormone is the signal that tells your bone marrow to keep making red blood cells. Those red blood cells are what carry oxygen to every tissue in your body. When kidney function starts to decline, erythropoietin production drops with it, your red blood cell count slowly falls, and you develop a condition called anemia. Anemia means your blood is carrying less oxygen than it should, and the most universal symptom of low oxygen delivery is exhaustion that sleep does not fix. Waste buildup in the blood adds to the same fatigue, because those toxins your kidneys would normally clear start interfering with how your muscles and brain use energy. In my own practice, this is the symptom patients mention almost in passing, usually phrased as, "I just don't have the energy I used to." They blame work, they blame age, they blame everything except the one organ quietly behind it, and I understand why. Fatigue is the most generic symptom in all of medicine. Everyone is a little tired, everyone has a reason. That is exactly what makes it dangerous as a kidney sign, because it never stands out enough on its own to send anyone looking in the right direction. Here is a distinction that actually helps. Ordinary tiredness from a bad week tends to respond to rest. You sleep in on a Saturday and you feel mostly back to yourself. Kidney-related fatigue does not respond that way. It sits underneath you no matter how much you sleep, because you are not actually short on rest, you are short on oxygen delivery, and you are carrying around waste your blood was never designed to hold on to for this long. If a full weekend of doing nothing does not touch your exhaustion, That is the version worth paying attention to. The test to ask for is a basic complete blood count alongside that eGFR I mentioned. Both are inexpensive and usually already part of routine blood work, so ask to see the actual numbers instead of just hearing the word normal. The second sign is swelling in your ankles, feet, or around your eyes, especially first thing in the morning. Doctors call this edema, and most people assume it is just from standing too long or eating something salty the night before. Sometimes that is exactly what it is. But when this swelling becomes a regular pattern, especially puffiness around your eyes when you wake up, it deserves a second look. Your kidneys are responsible for keeping your fluid and sodium balance steady. When filtration slows down, sodium and fluid that should be leaving your body through urine instead stay behind, and that extra fluid has to go somewhere. Gravity pulls a lot of it down into your ankles and feet over the course of a day, which is why it is often most noticeable in the evening. But puffiness around the eyes in the morning points to something a little different, often related to your kidneys leaking a protein called albumin into your urine instead of keeping it in your bloodstream where it belongs. Albumin normally helps keep fluid inside your blood vessels. When you lose too much of it, fluid drifts into the surrounding tissue, including the thin skin around your eyes. To use this sign well, pay attention to the pattern. Is it both ankles or just one? Both ankles pointing toward a kidney or circulation issue is a very different conversation than one swollen ankle from an injury. Another detail worth checking, press a finger into the swollen area for a few seconds and let go. If the indentation stays visible for several seconds before smoothing back out, that is called pitting edema, and it is a stronger signal of fluid retention than swelling that bounces back immediately. If you are noticing both feet swelling regularly or waking up with puffy eyes more mornings than not, that urine albumin test I mentioned earlier is exactly what catches this early, often years before swelling becomes severe enough that everyone around you notices it too. So far, both of these signs come from the same root problem, fluid and waste, that should be leaving your body and is not. The next few signs come from a different angle entirely, and this is where it gets interesting, because some of these you would never connect to your kidneys on your own. Stick with me, because sign number 6 is the one almost nobody sees coming, and it is probably affecting more people watching this than any other sign on the list. If someone in your life has mentioned they feel tired all the time or has noticed swelling they cannot explain, send them this video, because this is exactly the kind of pattern that gets brushed off until it is much further along. The third sign is foamy or bubbly urine, and I want you to actually pay attention to this one the next time you are in the bathroom, because most people never look. A small bit of foam from the force of urination hitting the water is completely normal and means nothing. But persistent foam, the kind that looks almost like a bubble bath and sticks around after multiple flushes, is your kidneys telling you something specific. That foam is caused by the same protein we just talked about, albumin, leaking into your urine in higher amounts than it should. Protein lowers the surface tension of liquid, which is exactly what creates foam and bubbles, the same reason soap foams in water. Healthy kidneys filter your blood through tiny structures called glomeruli, which act like a sieve, letting waste through while holding on to things your body needs, like protein. When those filters get damaged, the holes in that sieve essentially get bigger, and protein starts slipping through into your urine instead of staying in your blood. This is one of the most useful signs on this entire list because it is genuinely an early warning. Protein often starts leaking into urine before your eGFR number even drops, which means foamy urine can show up before a standard blood test would flag anything at all. If you notice this pattern more than once or twice, that urine albumin test is the single most direct way to confirm what your eyes are already telling you. The fourth sign is urine that has changed color, particularly urine that looks dark, tea-colored, or has a pink or reddish tint without an obvious explanation like beets or certain medications. Your urine color is essentially a live readout of your hydration and your kidney function, and most people only ever check it by accident. Normal, healthy urine is a pale straw to light yellow color, caused by a pigment called urochrome that your kidneys filter out as part of normal waste removal. When urine turns dark and concentrated even though you are drinking enough water, it can mean your kidneys are not filtering and diluting waste the way they should. A pink or reddish tint is a different and more specific signal. That can mean small amounts of blood are entering your urine, called hematuria, which happens when damage to those same filtering structures, the glomeruli, allows red blood cells to slip through alongside the protein we just discussed. I tell my patients to use a simple rule. If your urine color does not match how much water you have had that day, and it stays that way for more than a day or two, it is worth mentioning to your doctor, especially alongside any of the other signs on this list. A simple urinalysis, which is one of the cheapest tests in all of medicine, will tell you immediately whether blood or excess protein is present. The fifth sign is needing to urinate significantly more or significantly less than your normal pattern, especially increased urination at night that disrupts your sleep, a pattern doctors call nocturia. This one is sneaky because everyone assumes it is just aging or drinking water too late in the evening. Here is the actual mechanism. Early in kidney decline, the kidneys sometimes lose their ability to concentrate urine properly overnight, which means they keep producing urine at a steady rate around the clock instead of slowing down while you sleep the way healthy kidneys do. That is what pulls you out of bed 2, 3, sometimes 4 times a night. Later, as kidney function declines further, the opposite can happen, and total urine output drops because the kidneys are filtering less blood overall. So this sign can point in either direction, but both directions point back to the same organ. If you are waking up multiple times a night to urinate and it has become your new normal rather than an occasional thing, do not just chalk it up to getting older. Bring it up specifically as a kidney question, not just a sleep question, because those two conversations lead to very different tests. The sixth sign is one almost nobody connects to their kidneys, and that is high blood pressure that is becoming harder to control, or blood pressure that was always normal and is now creeping up for no clear reason. This relationship goes both directions, which is exactly why it gets missed. High blood pressure can damage your kidneys over time, and damaged kidneys can also cause your blood pressure to rise, which means it becomes a feedback loop that quietly accelerates itself. Your kidneys help regulate blood pressure through a hormone system that controls how much sodium and fluid you retain, and through a hormone called renin that helps control how tightly your blood vessels constrict. When kidney function starts slipping, this regulation system gets thrown off, sodium and fluid retention increases, and your blood vessels can constrict more than they should. The result is blood pressure that climbs even if your diet and activity level have not changed. This is also why blood pressure and kidney function get treated as two separate problems in most checkups, when biologically they are really one feedback loop with two readouts. High pressure inside the tiny filtering vessels of the kidney damages them over time, the same way too much water pressure damages a hose over years of use. Damaged filters then struggle to regulate fluid and sodium properly, which pushes blood pressure even higher, which then damages the filters further. Once that loop starts, it tends to feed itself quietly in the background for years before either number, your blood pressure reading, or your kidney function moves enough to set off an alarm anywhere in a normal checkup. If you are on blood pressure medication and your numbers have been creeping up despite taking it consistently, or your doctor has had to increase your dose more than once recently, that pattern alone is worth a kidney function check. This is exactly the kind of thing that gets treated as just a blood pressure problem in isolation, when really the blood pressure and the kidney are part of the same conversation. The seventh sign is a metallic taste in your mouth or a noticeable loss of appetite, particularly an aversion to foods like meat that you normally enjoy. This sign tends to show up a bit later than the others, but it deserves a place on this list because people almost never connect appetite changes to their kidneys, and it often gets explained away as stress, getting older, or just being a bit off. When kidney filtration slows significantly, a waste product called urea, which is normally filtered out and removed in your urine, starts to build up in your bloodstream. Bacteria in your mouth and gut can convert some of that excess urea into ammonia, and that ammonia is what produces a persistent metallic or sour taste, sometimes described as tasting like you have been sucking on a coin. That same waste buildup affects appetite directly, dulling your sense of taste and making food, especially protein-rich food like meat, taste unappealing or even slightly off. If you have noticed food tasting different lately, or you have gone off red meat without really deciding to, and it has been paired with any of the other signs we have covered, that is a meaningful pattern, not a coincidence, and it is worth mentioning specifically to whoever orders your blood work next. The eighth and final sign is dry, itchy skin that does not respond to lotion the way it used to, sometimes paired with muscle cramps, especially in your legs at night. These two often show up together because they come from the exact same root cause, a mineral imbalance. Healthy kidneys are responsible for keeping minerals like calcium, phosphorus, and potassium in a very precise balance. When filtration slows, phosphorus in particular tends to build up in the blood because the kidneys are not clearing it the way they should. That excess phosphorus pulls calcium out of balance as well, and this mineral disruption is what triggers both persistent itching because of how those minerals affect nerve endings in the skin, and muscle cramping because calcium and potassium are essential for normal muscle contraction and relaxation. When that balance drifts, your muscles, especially in your legs, can cramp up out of nowhere, often waking people up at night. If you have been reaching for lotion after lotion with no real improvement, or you are getting leg cramps that seem to come from nowhere, especially at night, and this is showing up alongside even one or two of the other 7 signs, this is exactly the kind of combination that deserves a conversation with your doctor about kidney-specific blood work rather than just a skin or muscle conversation in isolation. Let me tell you about someone I will call Robert. 58 years old, worked construction his whole life, and came to me because his wife had practically dragged him in. He had been exhausted for months, blamed it on his knees and his job. His ankles had started swelling most evenings, which he blamed on standing all day, and for a few weeks he noticed his urine looked foamy, which he genuinely thought was just normal and never mentioned to anyone until his wife asked him directly. On top of that, his blood pressure, which had been stable on the same medication for years, had crept up enough that his pharmacy flagged it. What stuck with me about Robert was how reasonable every single one of his excuses sounded on its own. 30 years of physical labor genuinely does wear down your knees and your energy. Standing on concrete all day genuinely does make ankles swell a little. None of his explanations were unreasonable. That is exactly the trap. 4 separate, individually plausible explanations were quietly covering for one real one, and nobody had ever laid all 4 side by side until his wife forced the issue. None of those 4 things on their own had sent him to a doctor. Together, they were enough that I ordered an eGFR and a urine albumin test the same day. His eGFR came back reduced, and his urine showed a meaningful amount of protein. That combination told us he had early-stage chronic kidney disease, almost certainly connected to blood pressure that had been quietly running a little high for years without him realizing the two were related at all. Here is the part that matters most. Caught at that stage, this is often manageable, sometimes for years, sometimes much longer, through blood pressure control, dietary sodium and protein adjustments worked out with his doctor, and consistent monitoring every few months. Robert did not need dialysis. He needed to actually know what was happening inside him while there was still plenty of kidney function left to protect. I remember him asking me, almost embarrassed, why nobody had ever told him to watch for this. The honest answer is that nobody had ever sat him down and connected these 4 ordinary feeling symptoms into one picture before, because individually, none of them are alarming enough to make anyone stop and look. 2 years later, his numbers have stayed stable because he stopped ignoring his own warning signs and started treating his checkups as something worth taking seriously rather than a box to check. So let me tie all 8 of these together because this is the part that makes them useful instead of just scary. Fatigue and appetite changes come from waste and toxins building up in your blood that your kidneys would normally clear. Swelling, urine color changes, and foamy urine come from your fluid balance and your filtering membrane, letting things through that should stay in your blood or holding on to things that should leave. Blood pressure changes, urination pattern changes, and the mineral imbalances behind itching and cramps come from the hormone systems your kidneys are supposed to be quietly running in the background every single day. None of these symptoms exist in isolation inside your body, and that is exactly why noticing 2 or 3 of them together matters so much more than noticing just one. I want to draw one clear line before I give you tonight's plan. This video is not a diagnosis, and it is not a reason to panic if you have noticed one of these signs once. Plenty of these symptoms have completely ordinary explanations that have nothing to do with your kidneys at all. Dehydration, certain foods, a poor night of sleep, a new medication, all of these can produce similar symptoms temporarily. What matters is the pattern. One symptom once is probably nothing. 2 or more of these showing up together and sticking around for more than a couple of weeks is what justifies asking for the specific blood work, not waiting for your next scheduled physical to maybe catch it. And if you already have a kidney condition, are on dialysis, or take medications that affect kidney function, please do not use anything in this video to second guess your treatment plan or your medication. Bring this list to your nephrologist or your doctor instead and let them interpret it alongside the actual numbers they are already tracking for you. This video is meant to help you start the right conversation sooner, never to replace the conversation itself. So here is what to do this week. 4 simple steps. 1. Think back over the last month and mentally check off how many of these 8 signs you recognize in yourself. Honestly, not the way you would describe yourself to a doctor in a rush. 2. If you notice 2 or more, call your doctor's office this week and specifically ask for an eGFR blood test and a urine albumin test by name, because asking for kidney function tests by name gets you the right test instead of a general panel that might not include it. 3. If blood pressure is one of your signs, start tracking it daily for the next 2 weeks. same time each day, so you walk into that appointment with real data instead of a guess. 4. Regardless of what you notice, start paying attention to your urine color and foaminess for the next week. It takes 5 seconds, and it is one of the most direct windows you have into how your kidneys are doing right now today. You do not need to be afraid of your kidneys. You need to actually listen to them because they have been talking to you this whole time in a language most people were just never taught to read. Now, a lot of you have asked me a related question after watching videos like this, and it is this. If high blood pressure and kidney damage are this closely connected, what should your blood pressure actually be, and at what number does it start to genuinely put your kidneys at risk? I made a video that breaks down exactly that, the real numbers, what they mean for your kidneys specifically, and what to do if yours is creeping up. I will put it right here on the screen. Go watch that one next, and I will see you there. Dr. William,